This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
This is an 80-year-old gentleman who has pseudoexfoliation and a brown cataract. It's almost grade 5. Pupil is moderately dilating. The incisions have been made. We already have the markings for the toric lenses put, and the capsule is also stained. So we're beginning the surgery by injecting OVD into the eye. And because pupil is not very well dilated and it is a slightly denser cataract, I don't want any intraoperative meiosis. With that objective in mind, I'm going to use a pupil expansion device. In this case, I'm using the Gupta expansion ring. For insertion, I usually prefer to load it in a lens cartridge and then inject the device into the antechamber as is being demonstrated now. The conventional butterfly cartridge, which we use for our hydrophilic and hydrophobic lenses, will do the job for this. Just place it inside the cartridge and push it into the antechamber. So I'm using just the Sinskey hook to gently maneuver the notch so that it engages the pupillary margin. So this device, just like the Malyogian ring, has this 4 notches, and the first 2 notches are engaged onto the pupillary margin. For the engagement of the third notch, I'm going to retract the iris with my right hand Sinskey hook, and the left hand holds the ring, and gently the notch is maneuvered so that it goes in and engages the pupillary margin. Similarly, the last notch is then engaged onto the pupillary margin using the Sinskey hook. We have a decent expansion of the pupil, but I want to stretch it a little bit so that I have wider expansion. So I'm going to use 2 Y hooks to gently stretch the pupil a little bit more so that it will help me to have a better view. Of course, I'm also using adrenaline in the BSS bottle. About 0.3 ml is mixed in the bottle of 500 ml of BSS. So even that should help us to have a wider pupil. Now, as we all know that we are going to expect some amount of zonular weakness in eyes with pseudoexfoliation, and the moment we touch the capsule, that's the time when actually we know the health of the zonules. And so of course, when I turn on the retroillumination, the red glow is better and the visibility is also good. As I'm touching the capsule, I can see a little bit of wrinkling of the capsule, but nothing to be very much alarmed of. As I'm dealing with a very dense nucleus, my goal is to have a rhexis which is at least not less than 5.5 millimeter. So I'm expecting this pupil to be around 5.5 to 6 millimeter, and this acts as a perfect template for me to fashion my rhexis or size my rhexis. So my rhexis would be around 5.5 or 6 millimeter in this case. The rhexis is completed. Time to perform the hydrodissection. So in these dense brown cataract, it's very critical to do a gentle hydrodissection. By that I mean I'm going to use extremely low amount of fluid so that we don't increase any pressure in the bag, because we need to be mindful that the posterior capsule in these brown cataracts will be very thin, and an excessive intracapsular pressure can result in capsular blowout. So you need to use very little fluid, maybe try it at multiple quadrants with using small amount of fluids, and invariably will be successful in ensuring that the nucleus is mobile. So you need to be very gentle and use as little fluid as possible when performing an hydrodissection in these dense cataracts. The bag is decompressed by pressing the nucleus on either side, and the nudging the nucleus just ensures that the nucleus is free. It's also confirmed by rotating the nucleus using a Sinskey hook. The superficial epinucleus and the cortex is then aspirated out. My strategy is to perform a stop and chop technique in this dense cataract. Please note that my second instrument is stabilizing the nucleus as I am trenching. You can note that I'm using 90% torsional energy. I'm using just the torsional energy to sculpt. There is no use of longitudinal energy when you're sculpting, because torsional has got an excellent ability to cut. The machine is Legion, and I'm using a balanced tip because it gives better cutting ability in these denser cataracts. Of course, no financial interest. Now, since the nucleus is very dense, I want to sculpt as deep as possible. My goal is to go at least 85 to 90% depth before attempting a lateral separation. A couple of attempts are required for this lateral separation, but if you can observe, my left hand instrument has not gone right deep until the posterior plate. It's quite away from the posterior plate. This is not the most ideal way to do the lateral separation. I would have preferred to place the instrument much more deeper. The lateral separation is good enough, but still not through and through, and the nucleus is rotated, and the second half of the nucleus is then undergoes the same process of lateral separation. As I'm rotating the nucleus, please note I'm using both the instruments to rotate. This I call as a bimanual rotation of the nucleus. This ensures that we are going to induce very less stress on the capsular bag and the zonules as we rotate, because we're using 2 points on the nucleus, one with the chopper and second with the phaco tip. This adds on and gives better torque when you're trying to rotate. This technique is especially handy when you're working in eyes with weak zonules. And finally, we have 2 heminucleus. There's one fiber or a bridge which is joining between these 2 heminucleus, which is refusing to budge. But nevertheless, it can be taken care of later. So time to divide each of these heminucleus into smaller fragments. The tip is buried into the substance of the nucleus. The chopper goes down vertically. 1, 2, and 3. Few attempts are required to break the posterior plate. Same thing is being repeated to divide the second part of the nucleus. So now we have got 3 fragments in the heminucleus, and each of them is pulled out of the bag at the level of the rhexis margin and then emulsified in a controlled manner. Again, for chopping I use just the longitudinal energy. For the quadrant removal, I'm going to switch back to the torsional energy, wherein we want to utilize the more efficient cutting ability of the tip. OVD is replenished into the eye, and time to divide the second heminucleus. Please note that almost 80% of the tip has been buried into the substance of the nucleus. This is how we're going to get a better hold when you're trying to do a vertical chop in such dense cataract, especially with the Elcon machines where the tip is very thin. So it's mandatory that we bury the tip quite deep into it, and that ensures a better hold, which is critical especially when trying to divide these dense nuclei. The chopper is placed exactly in front of the tip, and then it goes down, and then the lateral separation maneuvers are being done. The chopper is progressively placed at deeper planes until the final posterior attachment of the posterior plate is broken. The entire length of the exposed tip is buried into the substance of the nucleus. The chopper goes down vertically, and then we're going to have lateral separation maneuver with my second instrument at a progressively deeper plane. But as we can see, there's still a small bridge which is attaching these 3 fragments together, and this is quite leathery. One simple trick is when we are having a bag which is half empty, just to flip the nucleus around so that this posterior plate bridge which is attaching all these 3 fragments together is just propped up a little and it's exposed, and that is then with a gentle, and then when we just use a small phaco power, the bridge is broken and all the 3 fragments are free. So now we have the 3 fragments free from each other. The first fragment is then held and pulled out of the bag and then emulsified. Time to replenish the OVD. When we are operating on these denser cataracts, I think we need to keep a certain amount of time just for putting the OVD inside. I make it a rule that I would replenish the OVD at least 3 times in such eyes once I begin the nucleus emulsification. And it does help in having better corneas on day 1. The last 2 fragments again are emulsified in a very controlled manner. I'm trying to emulsify as posteriorly as I can. Mind you, the level of emulsification is important. The farther away from the cornea, the better we are as far as endothelial safety is concerned. And I'm emulsifying it at the level of the pupillary margin or below it. And this plays an important role on how your cornea looks in the first post-op day. So there's hardly any cortex for me to aspirate. I'm just using some BSS to squid on the posterior capsule just to clean it up a little bit. I plan to insert a CTR. Another challenge here is the rhexis is quite big and the edges of the rhexis are not seen all around. They're seen only at one particular quadrant. So when placing a CTR, I want to ensure that it goes into the bag itself and not in the sulcus. The bag is pressurized with OVD and the CTR is gently slid into the bag. And at this point, I can see the tenting up of the rhexis margin. This indicates that the CTR is well and truly in the capsular bag and not above the intercapsule. And as is customary, I use a Synth-Cuke. I'm using a slightly longer Synth-Cuke, which gives us better ways to compress it. It's compressed and the entire CTR is gently dialed in. So this is one of the ways by which we can be very certain that the CTR has gone into the bag, especially when you are dealing with eyes where the pupil is not well dilated and the rhexis is also not very clearly visible, as was in this case. The planned toric lens is implanted into the bag. Time to explant the expansion device. I'm using Synth-Cuke to disengage all the notches from the pupillary margin. And once all the 4 notches are disengaged, it's simply quite easy to remove it out. Just hold it with the forceps and then pull it out. The OVD behind and in front of the lens is irrigated out. The side ports are hydrated. The lens is then aligned in its intended axis. And that's it, the case is done. These are the first day post-op pictures and the patient did pretty well. So that was it. Thank you for watching and hope you found this helpful.